Welcome to the Inspiring Tech Leaders podcast with me, Dave Roberts. This week, my special guest is Paul Fleming, Strategic Director of Resources at Blackburn with Darwen Borough Council. Paul is an established technology leader of large teams, major programs, and transformation. He is a creative thinker that focuses on getting the best from people and technologies. He has previously held senior technology positions within the NHS and across the private sector. Paul attended the University of Salford and subsequently achieved a Master of Science degree in Health Informatics from the University of Central Lancashire, as well as a Global Health Leadership Certificate from Yale University in Digital Futures. It's great to have you with us here today, Paul.
Yeah, thanks for having us, Dave. It's a pleasure to be on.
So, how did you start your career in technology? And was it the career path you expected to take?
So how I started, I suppose I didn't come in a traditional route. I'd come out of university, I'd studied business, and I got a job with my father actually, and I was on a reception for a very short time, and I was doing a lot of like data input, and I ended up doing this input faster than it had been done before. And one of the senior managers there, he had some connections with IBM, and he said, look, you need to go and speak to these people. So to cut a long story short, I got an interview and I joined IBM and I joined tech world at the age of 21. And I started out right at the bottom on a service desk, supporting people around Europe, getting them to work through IT issues and solving as many as I could on the first line, and moved on from there really. And was it where I expected to be? I'm not sure. I had a massive expectation. I wasn't sure what I wanted to do then. I'd always, I suppose, had computers in my life and my old Spectrum 48K plus when I was a kid, and always liked technology. And I liked music technology a lot as a teen growing up. And I suppose the careers I'd had in my mind, anything from the RAF to building to being a musician, which I did keep going. But I think tech has suited me really well because it's just the logic of it and the ability to innovate and solve problems using something that is forward thinking and innovative by nature. So yeah, it suits me well.
I started out on the IT service desk as well, so it gives you a really good introduction to technology and IT. And similar to you, always been in a technology career. But you spent about 14 years with the NHS. So what was the motivation to move away from that and into your current role with Blackburn and Darwen Borough Council?
Yeah, I ended up in the NHS. That again wasn't by design. It was just something I drifted into, I suppose, and had a fantastic time with the NHS. And I noticed the real difference. I'd worked in the private sector before that, IBM, ICI, then INEOS took ICI over, Capita for a short while. When I joined the NHS, I just got this huge sense of purpose. And that goes across public services in general. It felt very, very different. That the drivers just felt different. The motivations were different, and the day-to-day felt different. So I could feel the impact I was having there. So I spent a long time there. I even did a Health Informatics master's degree, funded by the NHS. Forever in their debt in a lot of ways. And I kind of rose through the ranks there. And I suppose why I left, there were probably a few reasons. One was around location. I wanted to be nearer home up north. I'd been working in the Midlands and East for NHS England and working a lot around the country, doing bits of national work and regional work. So I wanted to be a bit closer to home. And ultimately, I was approached. I was kind of headhunted for a process. And it was a bit of a curveball. Local authority, it's not something I'd thought about before. I'd worked with local authorities, but never for a local authority. But I'd been particularly interested in the wider determinants of health, and I grew that sort of appetite through my NHS career. I could see that the NHS deals a lot with the reactive side of care. So when someone's ill, the NHS reacts to that. Someone needs help urgently, an acute care. But actually, the things that drive that, the wider determinant, people's background, their economic situation, the whole sense of place and how you build a place around people and communities. That was a massive interest to me, and the whole public health agenda. So it seemed a good opportunity. I was approached and I went for it, and I was lucky enough to get it.
That's fantastic. I know it's certainly been a tough couple of years, really, with so much focus on the global pandemic, but how have you been able to use tech for good during this time?
Yeah, I think through the pandemic, maybe the role of councils hasn't been as visible as others. There's a lot of front-facing services. NHS obviously was hugely hit. supermarkets and supply chains. My father-in-law's a baker, and I've never seen anyone work as hard as he did through the pandemic. But the role of councils kind of got underplayed. I felt we were picking up what turned very quickly into a humanitarian crisis. So as soon as Boris told the country to lock down, we had to step in, and we were able to use technology in many different ways. There were some reactive things we had to do. So the workforce overnight worked from home. We had probably 90% of our office-based workforce was working from home, and those who couldn't work from home for sort of situational reasons, they were accessing the offices in a very limited way. But we had to upgrade infrastructure very quickly because it wasn't set for that size of demand. And we did that very quickly. We upgraded all that infrastructure, firewalls, different systems. We were getting more kit out to people to use, tablets, laptops. We were redeploying staff very quickly. So staff who were in leisure centres, those leisure centres then closed, and we were redeploying them to support people with things like food and supplies. And we did a couple of things, maybe on a different scale to the councils here in Blackburn. So one, we set up a food distribution hub, which was a 30,000 square foot warehouse. We worked with Euro garages to get access to that space. And we underpinned that with that whole end-to-end process of people requiring help, whether that was to get access to a box of food and essential supplies, or to get access to befriending support, mental health support, help to get your medication delivered because you couldn't get out to the pharmacy to do that. We had an end-to-end process that we underpinned with digital. So we just procured a low-code platform, and we weren't going to stand that up for another 10 months due to original project plans. And we stood that up within a month of procuring it, and we had forms online for people to get that help, and also forms for businesses and individuals to get financial support. So the grants that the government were processing, we turned them into digital forms 24/7, so we could process those quickly and get support to businesses and individuals as quickly as possible. And these things, I say it's been underplayed. You wouldn't have noticed those things happening. You would have known the government were running with different schemes to support individuals and businesses, but we had to administer all of that. So in all, 27 forms, 30 forms were produced, digital forms for many, many different reasons. And then we found ourselves in Blackburn and Darwen at the epicenter of the transmission of the virus. So we were for a long time, and might still be, the highest level of community transmission in England and possibly the UK. And for a number of months in 2020, we were the top spot. And that brought, unfortunately, more interventions and more restrictions from government for our borough in particular. And there were other areas affected in similar ways, areas of Greater Manchester, Liverpool, Leicester. You will have seen these places on the news, and we had to step up in a different way than anyone else did. And it was horrible and difficult in many ways, and you were coming in, and every day you didn't know what to expect. Week by week, a Monday morning meeting, it was right, what's hitting us next? But in other ways, it was amazing the way that the council and its people and our communities reacted in the face of that adversity. And from a technology perspective, this is kind of cliched now, but we did a lot of change in a short amount of time, and it was kind of wondrous to me what we were able to achieve. I'd not seen that kind of performance and technology enabled change in all my career anywhere near that. And I'd worked in some great places with some great teams, and was massively proud, and still am massively proud of what we've been able to achieve through that time.
Well, I think it's something to be very proud about indeed, and I think it's an excellent example of how using low code and no code platforms can help to really transform a way not just the business operates, but communities are impacted as well. So that's a really good story you got to tell there. What are the technologies that you're focusing on at the moment, though, and what do you think will be important over the next few years for tech leaders to focus on?
So probably not many surprises. I think there were a lot of core technologies we've been talking about for a number of years across the sector that have been coming to fruition. I think the great thing that COVID's shown is it's given us use cases for some of these technologies. So I think, first of all, data science and data technologies absolutely pivotal to what we're doing. Over the last 20 months, we've used data in lots of different ways. Through the pandemic, we had to use data and dashboarding. And we were quite immature in that journey, I think, prior to COVID. I came in here 3 years ago and put together a new data team, and we've built on that. But we were bringing together data sets from Public Health England, from ONS, so testing data from Public Health England, death registration data from the ONS, Office of National Statistics. We were bringing in hospital data on inpatients, so understanding what COVID was impacting the hospital, how that was happening. Outpatient information from community providers, so people who had COVID in the community and were being treated remotely with different technologies like pulse oximeters and different remote technologies. We were tracking that through the same dashboard, as well as ward level data and our contact tracing data. So on the contact tracing side, everyone's aware of what's been happening nationally, and that service was only of limited success in reaching the amount of people traced to tell people to self-isolate. We brought in the first, alongside Leicester, the first local contact tracing service. And again, that was data driven, and that fed the dashboards. Now, when you bring all that data together, you get real insights. So that's shown us a different way we could work with our partners, and partnership data is vitally important when you're working in place and in public services as a borough, as a town, as a city, whatever that region is defined as. So we can do so much more with that now. We can predict data. A good example actually is our food distribution hub. We were predicting the amount of food we were going to deliver to people months in advance, and we were predicting and modelling how we could take that service down eventually and put it back into the third sector and the food bank sector particularly. So forecasting, modelling, that paves its way really to data analytics, predictive analytics, which is what we need to do much more of. Data in public services is fantastic, and I suppose it varies from organisation to organisation. Particularly what I thought Public Health England were doing, and the gov.uk teams in presenting data, was a real eye-opener on what can be achieved in building that trusted discussion with the public around how you present data, how people utilise that data. So data science, open data, particularly, that's something we want to move to, and building into that artificial intelligence, machine learning as we move forward on that journey. For us, there's a lot of foundational steps still to go in, I think, before we're at a point where machine learning is driving a lot of operational decision making. I think other places I've seen that happening really well, and some are further on that journey than others, and further on than us in many respects. So data would be the first side of things. I think serverless technology, cloud technologies as well, that's something we're really pushing, and bring cyber in here. Part of that is for me is around distributing that infrastructure better so that it's more resilient, more cyber resilient, but also looking at the ambition for the council, and I think public services in general, where we want to head in the future, using things like predictive analytics, using the web as our front door, increasingly so, to build digital first services end to end. We need a scalable infrastructure that is just probably not economical to do on the premise. So we've been moving towards cloud for a couple of years now. We've been using some of our suppliers around the proprietary systems that we've got for things like payroll and finance, and moving those systems off premise into the cloud, reducing the cost of managing that locally and increasing the efficiency and scalability of that. And also, obviously, people have been working from home, and it's driven this flexible environment now. So we've got to design the infrastructure around a new workforce, a new type of working. So that's really important. Our web technologies vitally important, and using open source. So we redesigned our website back in 2019, and since then we've been really iterating that in line with gov.uk guidance, service patterns, service principles, design principles, as part of the National Digital Declaration, which is a really important piece of policy initiative that brings councils together to share code through GitHub and share knowledge and design things together. And funding goes out to councils, and it is a council initiative for local government authorities to come together and work on these things in a collaborative way. And that's driving so much exciting change for me. So the web technologies in particular. I mentioned cyber. Cyber, obviously, the trajectories are really frightening, and for any CIO, any digital leader, and in fact any leader full stop, that's got to be the top of the agenda. We have restructured a couple of times in the last 2 to 3 years. But one of the roles we did bring in was a cyber specialist role here to concentrate more on our cyber preparedness and the way we'd react in any events. And also, like, as we've moved more to a DevOps model, we've restructured the technical teams, moving away from traditional, I suppose, operational server network models to a DevOps model. We've built cyber into every job description in those DevOps engineer teams. So cyber, there's a lot more we can do on the technology side for that around predicting and preventing. So yeah, absolutely important. And then I suppose there's many things I probably want to talk about. The last thing I'll just mention is service design and agile methodology. So we've built a service design team over the last couple of years and really putting the customer, the resident, the service user at the heart of what we do. That is an often said phrase. And when I was in the NHS, I kind of got frustrated a lot because we always said we were being patient-centered, and the challenge in public services to be really patient-centered is to drop all those organizational silos. And when I was in the NHS is not a single entity. It's made up of many, many organisations in a regional and a national sense. You've got national bodies, like I work for some of those bodies, but bringing those organisations together is the real key, and it's the real value work. Going back to service design and putting the user at the centre of what we do, that means, for instance, what we've done is build a customer panel, and it's over 1,000 strong now, which in a borough like ours is pretty good. So we've got 150,000 people in our borough, roughly, and we're using this customer panel now to test out our developments and our designs with them. They're now co-designing with us. We're working in the open. We've got a blog out there telling people what we're doing, so all the residents and everyone else can see. We share that learning, but that co-design is so important. So for me, putting people at the heart of what we do and really doing that and making that part of our culture and making it part of almost every discussion we have, from an OD perspective, organizational development perspective, as we build roles, as we just have those day-to-day conversations to bring that agile practice through, not just in the digital sections, but right throughout our organization. That is a hugely important part of what we're doing.
Well, going through so much digital transformation that you've just described to me, how do you get the balance between being able to still transform the organization as you're doing, but also simultaneously support business as usual activities?
It's really tough, that. I think if you want to move forward, that is a really tough balance to maintain, and it's day-to-day management of that balance. What we can't do is stand still. So we have to move forward. We have to bring in new technologies. We have to bring in new skills. That involves a lot of change for people, for services, both internally and to our external customers. So it's a huge challenge. So some of the things we're doing on the technology side, we've restructured to bring in much more of a DevOps culture. As I've said, moving away from traditional organizational structures. We brought in a deputy chief technology officer role, which we've never had before. One of the challenges with that in public services is that the distinction of chief officers. Typically, a director is a chief officer here. But if you're bringing through roles like traditionally in the sector, they're called chief roles, chief information officer, chief technology officer. So you've got to have that discussion with unions and HR about we need to get these roles right. We need to get them with the right titles and kind of bucking the trend of traditional public services. So restructuring, getting the right skills into those teams, got subscriptions to platforms where people can now do self-learning in many, many different fields of technology. But to me, Dave, there's no choice. We have to move forward. We have to manage that balance, because if we weren't to move forward, we'll end up with legacy skills, legacy technologies that become more costly and more risky as time goes forward. So I think there's a lot for us to work on in taking forward our workforce, bringing them forward, making sure they're bought in. So when we do business planning, they're co-designed with many people. They're not a business plan or a strategy that's one person's take on things. We are bringing our workforce along with us and trying to reward them in the best ways that we can. We're picking up an award recently for the team. We won a digital transformation award, and that was such a shot in the arm for a lot of people. And when we brought the award back, we got the leader of the council, the politicians, our cabinet member for digital, as well as our chief exec, myself and others, we presented that back to the large team that was responsible for that work, and rewarding people in those ways, I think was a real shot in the arm. And we've got to remember to keep celebrating those achievements. So big change exercise. You've got to keep people on board, but you must keep moving forward.
Great advice. You also mentioned earlier about cybersecurity, and obviously that's more critical than ever these days. So how do you ensure that the organization remains efficient and reliable, but also, more importantly, secure?
Yeah, I suppose again, you've got the day-to-day challenges of staying compliant and secure, with making sure systems work for the services that utilize them. So what we've done recently, actually, we've moved our cyber role into the information governance team so that it provides some independence. Now, what we're working on is how that then interacts with our DevOps culture, because they are kind of two different worlds. Now, we've trained all of our directorate in agile skill, which I suppose DevOps, with its approaches, is kind of rooted in agile manifesto type of worlds. So we're working on how we continue to improve that and do security, do cyber in the most agile way that we can, and the most effective way that we can. That's on the tech side. That's on our team side. Anyone will know that the weakest link is the people, the users out there. So one thing we did that was really key was we made cyber security training mandatory for all of the organization. Now we obviously had information governance training as mandatory. I say obviously in public sector that is mandatory training for almost any organization, I would imagine, especially it was through the NHS. You have to get that mandatory training over a certain point and very close to 100% across your organization to get access to wider data sets, etc. So we had IG mandatory training. We've now got cyber mandatory training on top of that. And we've got fantastic uptake of that. It's really very close to 100%. It's only people who are off on things like maternity leave or long-term sick that don't do that training. And the results, the compliance with that training is fed through with my senior information risk officer reports into the board every quarter. So if people haven't done the training, directors are held account for that. So that culture, treating cyber and information security and governance the same as you would when I was in manufacturing, health and safety. Health and safety was zero tolerance in ICI and INEOS when I worked for them. And information governance and sort of cyber activity has to be the same. And I think over the years that's changed, that's got better. I think if you rewind 10 years ago, that wasn't the case. It was, are we ticking the boxes around IG and information governance and cyber? Now it's a different conversation. It is the biggest risk for any organization. I would imagine every organization is built on tech, and cyber is the biggest risk to technologies, and by nature then is the biggest business risk. So you must treat it like that from a governance and a board perspective. And I suppose what I've tried to do more of is spread that ownership with the board. Digital's not my job, it's everyone's job. I'm here to steer us a certain direction, but getting directors, senior directors and heads of service in our place, getting them to own that agenda is key to anything. Governance is key when you're looking at these sort of processes.
Absolutely. You talk about the board there. So, what are those key factors that you think how you demonstrate the value of technology to the board? How do you communicate that to them?
Well, I think I'm lucky in this role. I was brought in at director level on the management board dealing with digital. That's first of all, that gives me a mandate here. We've also got a cabinet member, and this is specific to local authorities, but we've got a cabinet member for digital and customer services, who's the deputy leader of the council. So at the top of the shop, you've got the right leadership around a really important agenda. And I would give credit to the leader of the council and the chief executive and the chief exec before her to set that stall out, to take digital serious. I think in local authorities over the last 3 years, you've seen many, many more senior roles, director level roles. So that's the first step. And then working with the board, it's just spreading that ownership. It's making sure that every discussion is cognizant of the technology factors around it, and that our future strategy, for me, depends on the use of technologies, that the right use of technologies. So if we look at social care and health, if we don't move to forward-thinking technologies in those areas, demand will just outstrip the supply and the funding models. certainly in social care, but also in the NHS as well. That is well known about an aging population, a population with more long-term conditions in that old age. So we've got to change those models, and the only way to do that is by using internet technologies, internet thinking, technology thinking, and the most leading edge innovative technologies that we can. So artificial intelligence, the Internet of Things, particularly in those industries. So managing both demand and restricted funding going forwards, we must invest in technology and technology thinking. And they're the conversations that I have with the board members every day. I was with our director of adults and social care the other day, having exactly the same conversation. And it's making sure that ball is kept in the air day by day, week by week, that this is not a back office service. This is not something that you call the IT service desk, and that's your as far as your knowledge. Everything is built on technology in the majority of organizations, and especially our organization. So I don't really find that difficult at a board level. I think I've got open arms from people, and people want to transform, and people know the strength in the technologies. And I think, again, in my career in technology, I think over 15 years, that has changed massively. I spent many years trying to get GPs online with record access and patients being able to do more online, and even tried to get people using video consultation quite a few years ago, and that was really difficult. And that conversation has completely changed, and the crisis that we've had has helped that on its way in a kind of in a grim way, but a very transformational way. So technology sector is growing so much, and it's growing exponentially. So I find that conversation easier than it would have been before, and hopefully just gets easier for the future generations of CIOs.
It definitely is becoming easier. It's certainly much more focused now from the board on technology and the difference and the transformation it can actually occur for organizations. So I know you're also very passionate about diversity in technology. So can you tell me more about some of the initiatives that you've put in place and how you've created a positive culture around this and what the impact has been?
Yeah, I am passionate, but I just think it's the right thing. It's obviously the right thing. I've been brought up on a set of values from my parents. It's important to get diverse minds around problems. It's important to build diverse teams that are reflective of communities that you're serving. In our sense, if you're a private sector company, then build your teams around your customer base. But we have a very diverse population here in Blackburn with Darwen. We need to mirror that as best as we possibly can. So I'm really passionate about it, but I just want to do the right thing and also the best thing for the organization. The more diverse minds you've got around problems, to get creative and just more diverse community in your workforce, the better results you're going to get. I find that obvious, and it's so important that this is held up nationally. And I'm glad to see there's a great group in the NHS, the Shuri network, who've really grown over the last few years, and like women in tech, really important again over the last sort of 5 years. That's been growing. There's not enough women in technology and science, and that was a real eye opener. The more I learned about that, about how women drop off through the education system from scientific subjects and tech subjects, and the work that we're doing nationally around STEM and all that is hopefully going to change that. But that's a real problem, because we're just missing out on so much talent and so much diversity. But initiatives, there's not something I put my finger on and say, right, I've created this framework, and I know lots of people have done that, and mentioned some of those networks that do fantastic work. The way I work, Dave, is just having the right conversations with managers, so making sure that this is part of the day-to-day conversation again. So if a team is not diverse, then that's got to be a conversation live all of the time. And why is it the way it is? How can we make that more diverse? Where there's more long-term structural challenge to things like the skills pipeline, where can we go in that? So I'm a governor at the local college, and I think there's around 10,000 students at Blackburn College, and I'm really interested in how we build more skill and more. The only way to get more skills is to break the diversity barriers, because there's just not going to be enough skills in the market if you're going down a traditional makeup of workforce. So we need more women, we need more people from different backgrounds, different demographics, different races, all of that good stuff. But it's just part of conversations. I also do things like get it in job descriptions. So we're recruiting to CTO role this year, and there was a particular challenge for me in the harder technology areas, real lack of diversity. So the first thing that goes in that CTO job description is build a diverse workforce, build a diverse team. And recently, I started the pandemic as a director of digital and business change. I ended the pandemic as a strategic director of resources with finance and legal and customer services and a number of other departments. And I started the same conversations with those people. So it's not just a technology thing. This is a workforce thing. And sometimes having those discussions for the first time in a while for some people. So you've got to create a culture. Frameworks and initiatives are needed too. For me, it's about leading by example, leading every conversation. I've done things like I've been on panels before and I've said, look, in the preparation for those panels, I've said it's not diverse enough, and they've changed panels. It's important to stand up and be counted on things like that. And I found like people thank you for that. I was on a HR panel once, and I said, we need to get diversity better on these HR panels, and people thank you. So sometimes it's a bit scary to raise this stuff, but what I'd say to anyone is raise the right things, however uncomfortable that might feel. And it should never feel uncomfortable, but if it does, raise it anyway. And that's the way I manage things. So a lot of it is steeped in values. I'm in a very privileged position with my background. I had a good education and a good family background, and not everyone has those blessings. It's just about doing the right thing, leading by example, and getting the right leaders in place as well is key for that.
Couldn't agree more. So what have been your career highlights to date, and what do you think's been your proudest career moment so far?
Yeah, that's quite interesting. I suppose I move on continually, like quite a progressive person in my career. So I tend not to dwell on too many things. There's certainly some milestones. I think, I'll probably always be the most proud about what we've done in the last 18, 20 months through this pandemic. I don't think there's ever been a challenge. They're saying it's the biggest challenge since the Second World War, whoever they are. But we've had to just meet that challenge head on, and I'll always be proud of that. I suppose the work I did around access to records, I did a dissertation and a lot of research in Greater Manchester, worked with some real forward-thinking GP leads around that, and trying to move the online NHS world from a patient perspective. I'm really proud of that research and the continuing work I did after that. And I suppose not long off the back of that, I worked across Greater Manchester delivering the first technology strategy across all the partners. And there were 10 local authorities, I think 10 or 12 acute hospitals, many other NHS providers, and hundreds of GP practices. And I think there were 12 clinical commissioning groups to bring that group together as what is now known as an integrated care system at that point back in 2015. I'm really proud of that, because I watched that work carry on and grow further and get better. And I kind of felt proud of planting a seed there. But no, I'm just, I suppose I'm most proud maybe about where I've got to, from started on a service desk, ended up CIO, Chief Digital Information Officer, and now beyond with resources, with a wider remit where I can use that sort of technology influence across the business in a much more influential way. So I suppose I'm proud of the starting point and where I'm at right now. It's a total journey, that.
So what was the best bit of advice that you received during your career ascent, and what advice would you give to others who are just starting out on that journey now?
I can't think of any particular single bit of advice, sort of pithy advice. If there was something pithy I could say, it'd be always learn, be open to learning. That's so important. I went back to university. When I came out of Salford, I came out with a HND. I failed my degree in the second year and in the first year, and went on to graduate with a HND, which was a major disappointment to me. But it kind of gave me an appetite never to stop learning and never stop trying. And I went and did a master's degree when I was in the NHS, and I came out with a distinction. And it's shown to me that you can do these things at any point, that the right point is the right point for you. And I've always been open to learning and developing myself. I think one bit of advice I did get is, as I've gone further in the career, is to get coaching. Now, when I was earlier in my career, starting out the management route, I heard a lot about mentoring and coaching, but I found it totally inaccessible. I couldn't find a mentor. I didn't know how to broach that discussion with people. Like, how would you walk up to a senior person and go, would you be my mentor? if you don't know them really well, you've not got a good relationship. So I think that's something we really need to solve. And if there's people out there listening who want to have a conversation with me in the coaching capacity, mentoring capacity, please reach out on social media. And I think we all need to do more of that. But I took coaching as I got into sort of junior director level, and that was massively helpful to be able to talk through some of this stuff that I didn't feel I could talk to people about, generally, whether it's family or friends or colleagues. Discussions with a coach are very, very different, and that helped me massively. And I've done a couple of tracks of coaching with different coaches, and that's helped as well, like getting different perspectives from different coaches. So I think that I've learned a lot from that. But yeah, my father used to say, don't work hard, work fast. And I told him, no, work smart, like put your energy in the right places. And I suppose I've learned that as I've gone. And then maybe I'm saying all these like no pithy advice is another one. Be true to yourself and be yourself. And as I've got further in my career, I felt more comfortable to be myself. And actually, you perform better and you're stronger when you're full self. And I think people like Brené Brown have brought through a lot of that thinking, and it's really in more public consciousness now from career perspectives. But that's so important. You've got to be yourself, because you're never going to be as effective or enjoy yourself as much if you're not.
Well, that's been absolutely inspirational. So thank you so much, Paul. It's been really good talking with you today, and thank you for sharing those career insights and experience with our audience too.
No, it's a real pleasure, Dave. Yeah, thanks for having me again.
Please remember to subscribe to the podcast and stay tuned for more inspiring tech leaders.